Hello, everyone. Hello, everyone. My name is Nova West, and I'm a program manager at the Quality of Care program at the Center for Program Development, Implementation, Research, and Evaluation. I'm also with the Quality of Care program, who's recently integrated in this new thing, and it's getting me a while to get accustomed to this very long name. So it's my pleasure to be here. Thank you, Shay, for facilitating, and I'm so sorry Dennis isn't able to be here to
Actually, I am.
Oh, you are. Goodness.
He snuck in. He snuck in.
Just ready to speak into the room. Thank you.
So I have to talk nice about you now. Oh, thank
Glad
you
I
for
didn't say anything.
inviting me, Dennis, to this training.
Yes, thank
Quite
you.
welcome.
Thank you all for joining us. So actually I want to be respectful of everybody's time, so I'm going to let Nova go ahead and start.
Sure. So good afternoon, everyone. Again, my name is Nova, and it's a pleasure to be here to talk about such an important topic. I really treasure talking about systems thinking. And so today we're going to be talking about applying the lens of profound knowledge to quality improvement. So there are many approaches to system thinking. This is just one of them, but I think you'll find it important. I want this presentation to be as dynamic as possible, so I'll be engaging with you. So please talk back to me and feel free to use the chat box. All right, so I want you to help me finish the statement. Making a change within the healthcare system is? And you could also talk back to me, and some can write in the chat. Okay, let me see. Impossible, essential, not always easy, exciting, I love that, important, challenging at best, hard, slow, okay? I love it. These are all really great answers, and it can be all of the above. You know, there are positive things. Positive change is rewarding, but when you add in a complex system as a healthcare system, it adds another layer of difficulty. I mean, change is already hard in itself, and you're adding on making a change in a complex system like the healthcare. It does make it very scary. So all these things that I see in this chat is really really important, and because it's beneficial, you know, we really want to make the effort to make it possible, and that's what I hope this conversation will lend itself to. Carlene writes, requires multiple levels of approvals and persistence. Very true. So today, let me see, my mouse isn't, okay. So our learning objectives are, we want to learn the importance of systems thinking when making a change in a complex entity like healthcare. I also want to break down the different variables that impact the success of change ideas, and we'll be using the 4 lens of W.E. Deming's system of profound knowledge. I'm also going to talk about learning to apply those QI concepts and tools to make system level improvements. So I'm going to be saying the word system a lot. Okay, now this is what I saw when we were describing what making a change in healthcare system is. This little cartoon here. So, you know, when you're making a change in a system, it can make change overwhelming. And that's why we need models. And models are very useful because they're able to make change manageable, effective, and sustainable. It's an invitation to think broader than our own limited models, and so that we can make true and lasting change. So I want to look at it as Neo in the Matrix, when he had to opt to take the red pill and learn the scary and transformative truths, as opposed to taking the blue pill that didn't expand his that would leave him in ignorance and not expand his limited understanding. So why we're inviting you to think system, it's to be able to take these, broaden the way you see things beyond the small area that you work in. So, all right. So the lens of the system of profound knowledge has 4 interrelated components of knowledge. Ron Moyen developed the lens concept based on Deming's idea to discuss what is important in a system undergoing change. The lens provides a rich ability to interpret experience through these 4 areas. So you have appreciation for our system, understanding variation, the theory of knowledge, which includes the model for improvement and plan, do, study, act cycle, and also psychology. And that's where we get into the theory of human behavior. The intersection of all these components earns the word profound, but at the same time, these different areas are quite intuitive, and you'll see. So when we talk about, so we're going to talk about 2 different kinds of knowledge. So you have subject matter knowledge, which is the knowledge of the field acquired through formal and informal learning and reinforced with experiences. So if you think about you being in healthcare, you know how to improve, make changes in relation to healthcare. You know the area, the field that you work in. And in relation, if you're a salesperson, you know how to make changes to improve sales. And when you think about profound knowledge, that's deep insight into how to make the changes in a variety of settings. And when you combine these 2, you have your subject matter knowledge and the profound knowledge, it gives you an increased capability to make improvements. So they're both important, and that's really, you know, when we do quality improvement, and that's why you want to involve everyone in those that are knowledgeable in the field and those that are in the forefront of the field to the table when you're doing these improvements. So an overview of the Deming system of profound knowledge, I want to use a simple and important public health issue, very common to us, improving hand washing compliance, right? When you think about appreciation for a system, you think about, well, who's involved and what is the impact on those entities that are involved? So let's think of this program. They have surgery, the emergency department, and physical therapy. Now, who is hand washing compliance going to impact the most? You would say for surgeons and ER docs it's more important that they improve their they adhere to hand washing than physical therapists. And administration's role is going to be ensuring the policy and the resources to support compliance. So it's important to think about the system when you're thinking about how it's going to impact everyone in the system. And then when we talk about variation, we're looking at measures. Data shows variation at department levels, which reveal the different processes and the practices. Theory of knowledge, that talks about, well, what do you know? Back in the 1800s, there was little knowledge that infections are preventable. But in today, you might want to improve the knowledge that checklists are important for improving hand washing, and also the location of hand washing stations. So, and human behavior is also important because that's a human side of change. Change, you know, we mentioned how difficult it can be, and that's the limiting factor a lot of times is human behavior, us being motivated and knowing how to make those changes. So let's break it down into 4 different lenses. So we have the lens of the first lens of profound knowledge we're talking about is appreciation for a system. And I like that we say appreciate, because sometimes we might not appreciate the system because we think, oh, that's what's holding things up, or it's bureaucratic, or if it was just me alone, I would be able to get this done, but I have to depend. But you really have to approach this from being appreciative, because I think it's more accepting the reality and you're able to move forward. So here's this little cartoon where it's an example, I think is an example of people not understanding the concept of a system, where, you know, on one end of the boat, you know, there's crisis, and the other end they're saying, oh, I'm glad it's not on my end. But, you know, we need to look at it as we're all in the same boat. And it's very important to kind of approach when you're making a change that we're all together. We have this common purpose. So a system is an interdependent group of items, people, or processes with a common purpose. It has boundaries, it has constraints and bottlenecks. Therefore, when a fundamental change is developed, there's interdependencies within the system that must be considered. The whole is greater than the sum of its parts. If you don't understand the system you're looking to improve, then how can you possibly fix any of its parts? So I really want you to think about it. When you're part of the system, you have to think about the whole and not just your particular area. So systems thinking is not linear thinking. So we have this over here, you think if you do one thing, then if you do A, you're gonna get B. But it's a lot more complex than that, where there are just a lot of parties that are involved. Systems thinking is a way of making sense of the complexity of the world by looking at it in terms of wholes and relationships rather than splitting it down into its parts. So I want you to look at this example of the continuum of systems thinking. And this is an example about how to, this is taken directly from a nursing journal, where they were sharing about the difference between personal effort and individual care and a systems thinking approach. So from the staff of nurses who are trying to improve their client's life by preventing ulcers, on the personal care effort, it says, you know what, I will turn my patient. So that means I imagine the client is in their bed and they need to turn them at a certain amount of times in order to prevent ulcers. So then in the next level in this continuum, the nurse would say, I will post a note above the bed to remind others to turn the patient. And then if you go up another level, I will ask other nurses about products to prevent ulcers. And then at the further end, you have this other approach, which is, I will compare our unit ulcer rate with benchmarks. So if you only look at the issue that you're trying to solve as an event, you might not be addressing the underlying issues. You may be making temporary fixes and not involving anyone else involved in the process. You have valiant efforts, but it's short-lived. Now, I want to invite some people to share. Oh, I see something in the chat. Let me see. Yes, I love the boat example. To share an example of a personal effort they've had when improving linkage to care. Can someone share what a personal effort in improving linkage to care would look like? And I'm just going to give you some time. I am okay with a little silence. I know people have to digest information. I just want to help people to be comfortable with silence also. Okay, so an individual effort is transporting the client to the appointment. Great. Let's hear. Well, let's work with that. Okay, so let's build on that, and people can also put other examples. So what would be, if you wanted to move this to more of a systems level, how would you move this from individual care to a systems effort, systems thinking? So we're thinking about, creating a workflow. Okay. So I think, yes, a workflow would be a little bit more, would move it up into system level, because now you are the workflow, as long as it's not just for your individual self, you are inviting others into having all clients being transporting, creating a system where all clients, all persons involved are aware of the workflow and can participate into getting not just one client, but all clients. Okay, one says calling no-show patients. So yes, that could be a personal effort if you are, calling a patient, but to move it up to systems level, you're thinking about everyone who's involved in this effort and may want to involve, so everyone's calling patients. If it's only one person on your team that is working on the no-show patient, then that's an individual effort. So let's see. So someone says training. So yes, I think training is a great idea for not just dealing with the observable event, but it's dealing with systemic structures and different mental models, the underlying forces. Because if no one else thinks it's an issue, then you might need to have training in order to alleviate that. So I see Richard says, during intake, assess transportation barriers and create workflow according to patient needs to get them right. That's great. Yeah, so that's definitely more of a system level thinking to dealing with all the barriers. And I see Carlene says contracting with Uber for newly diagnosed and patients out of care. Jennifer says communicating policy on transportation to the clients. That's great. So yeah, so that's definitely more of a systems thinking. Let's move on. You know, when I press next, for some reason it doesn't. So, okay, so I really like this quote. It says, every system is perfectly designed to deliver the result it produces. Now, this is a very popular quote, and it's been attributed to so many people that I've decided to just leave that out. But it's such an important thing. So your system is perfectly designed to deliver the result it produces. And we're going to talk more about this when I move on to variation. So what are the faux pas of not appreciating the system? It can lead to risk of oversimplifying. Oh, the way I solve it is I do A and B and it's done. Or I tell the people around me to do A and B and it's done. But recognizing that it is complex and appreciating the fact that there's multiple factors, multiple belief systems, practices, people that are involved that might hinder or can move it forward is very important. So you don't want to run the risk of oversimplifying. And the way you need to do that is to start thinking system and involving everyone who's a part of the system to talk about their experience and share what they know about the issue in order to improve that area. So a systems approach, even though it might be comforting to say, you know, I'll do it my own, I care about this, is very important, although it's difficult, to invite people to the table to talk about the So another faux pas is focusing only on low-hanging fruit. So when you're not thinking about the deeper levels, you're really just, you really can't fix the major issues, and you may only be alleviating the simpler issues. And another thing is having the wrong attribution. So if you don't understand the system, you might not be aware of what's going on, or you might fall into just blaming, oh, it's this person, this is the reason why. Meanwhile, if you have the system thing, you more think about the processes and the workflow so that everyone can get on board. And then lastly, again, temporary fixes. Okay, so the next lens we want to talk about is understanding variation. So in healthcare, we see a lot of variation in our processes, in our procedures, in the equipment we use, in patient symptoms, and in outcomes. So variation is everywhere. We expect it. It's supposed to have. So that's why it's even called understanding variation. We're not trying to eliminate it. We're trying to understand it. So much of the variation is caused by the way we organize and provide services. And understanding variation is critical to managing systems effectively. Understanding the source of variation is important, as this determines what we should do next. So I love this little graphic. I'll use it in in almost every quality improvement training I do, because I think it, you know, it's just a great picture of trying to do your work. So there's a couple definitions that I want to talk about. So when you talk about, there's two types of variation. You have common cause variation, where that's those that are inherent to the system, and it affects everyone, inherent to the system, and it affects everyone working in the process. And I'm going to explain that a little bit more. Special causes, this is not part of the system, and that arises because of specific circumstances, and that could be positive or negative. But a key thing about special cause is that it's often unexpected. So the common cause is something it's just a part of your system. It's how your providers provide your services, right? So in this little graphic here, it's an example. I call it variation when producing uniformed cartoon dogs. So the aim is that this worker, all the workers really need to produce cartoon dogs. What are the variation we expect? What we think could happen in this little cartoon? Let me look at the chat. Who doesn't like that? Yeah. So what could happen? Say you have 4 workers and 1 machine, and they all do 12-hour shifts. What are some variation that could happen in this instance? The worker doesn't show up. Okay. They could, okay, great. Yes, yes. If a worker doesn't show up, workers could be overworked, or they could result in little Dachshunds not being of the same size. That's the aim. We're going to use a more real example soon. So for those. So I want to point out, so in this case, let's say in this instant, this company, 95% of the times they meet their goals and 5% they miss their goals. This says the system is perfectly designed to deliver the result it produces. So how it's set up is that 95% of the time, they're going to meet their goals and 5% of the time they're misses. Now, there might be something that they can do to improve the percentage of how they meet their goals, right? And then when you think about a special cause, what if a power outage happens, right? So that would be a special circumstance that's going to, you might meet 10% of the goals if we had a power outage. So so when you think about variation, common cause, you want to think variation by worker, exactly. So some might work faster than some. It could be by the time of day. You might find that, at the end of the day, you don't meet your goal. And also if you have a special cause variation, that would take you out of the limits. So one of the things that we use to understand variation is control chart. So when you develop a control chart, it describes to you how your organization, your program performs over time. So there's always going to be an up and down. You have to expect that some days you're gonna meet your goals, some days you're gonna be a little less. But it's a summation of every day that really describe what your program is capable of doing. So I'm gonna give you another chart. Okay. So here's a little bit more real life example. And I wanted to include this chart because this really describes common causes and in great detail. So yes, we do know that special situations occur, like a power outage, earthquake, things like that, that can cause, something, your system not to work. But we're going to look at common cause because this is how we tend to operate. So up and down is normal, because no system is linear. Many things are infecting the system, but the aim that you want to do is to minimize variation. So you want to look at variation. So to look at variation at a time, you're in this chart, you have an average of how it's produced. And in the first portion of the chart, you see a bigger gap between the upper control limit and the lower control limit. So what you want to do over time when you do your change idea is to limit the chaos, right? To make your system more predictable. So let's see, in this example, in year 1, we have clients tested for oral gonorrhea by clinic. And if you look at clinic A is not doing as great as clinic B. And what your aim should be is to have both clinics, if they're part of one system, be able to have a similar, operating at more predictable pattern. So there could be some sharing so that they both can be at that same level. So in year 2, you see clinic A, it has been able to improve and perform and closer to the standard. You also want to do, when you want to look at variation, and I really encourage this when we do quality improvement projects, is to look at tests by variation in different ways. You look at it by clinic, you look at it by provider, and this really tells you that maybe you can do something better. If one clinic is performing better than the other, you want to know, what is clinic A doing different than clinic B? If providers are performing differently, you want to know why. Is it because they have less clients? Is it because they have a different system? If they have different support, if the time of day is different, you want to really look at variation in different ways, and that really tells you how your system is performing. So I think data really tells you what is happening. So yes, it's a good good question. What is the measure? So I mean, the important thing about these charts is that your measure could be like percentage. This one is by number, but when you're creating your charts, you're going to want to look at it by, I suggest by percentage, so you can know how it's, in this case, if on a day-to-day, let me see, this is oral gonorrhea test. If you're 90% one day, and then the next day you're 80%, and then the next day you're 85, and then well, I mean that. So I see. I'll get to that question first about false positive, but so with oral gonorrhea tests, I would say for the clients that are eligible to be tested for oral gonorrhea, they would be in the denominator, and the numerator would be the clients that are actually received the test. So if there's any margin of error, I think the important is that they receive the test. So it's not the clients that have been tested positive, it's the clients that have received the test. So apologies for that. I need to clarify that. So these are not clients that are tested positive. They're clients that have received that have been tested. So yeah, so it's important to look at variation when you have your data, and by clinics, yes, is a percent tested for gonorrhea, yes. So you want to look some ideas of what you could look at. You could look up by clinic, you can look up by provider. Can I hear in the chat what are some other ways you can look at variation? Or share ways you've looked at variation in your clinic, in your not just in your program. Or if anyone could share, I like to hear other voices. What are some ways you've looked at variation at your services? Okay. Number of visits per day by provider. Has that helped? Itamar, how did that help by looking at the number of visits per day by provider? How did that help you with quality improvement?
Hi.
What did that tell you? Yes.
It tells me where the potentially difficulties are per provider, and so we see that we can see the constraints. For example, if we have goals, we have 16 visits per day, and we see one provider 16 and another provider 10, and so forth. So that's one way of looking at this. Another way is to actually look at provider across several months and to see if there is variation across the month for each provider, and then identify why. If it's a no-show rate, also looking at the no-show. I mean, that's kind of where it gets really kind of more interesting, is when you look at the reasons for lower visits, for example. I don't know if it answers the question, but that's kind of
no, this does. Mm-hmm. It's important. It's important. And I think it's something about when you share rates amongst provider, and you could do it blinded too. You don't have to I've heard it work positively when you share the names so everyone knows, and I don't, as long as you have a healthy culture that doesn't feel like they're being shamed, but it's just really like, oh, well, let's see what is happening, and either by clinic or by provider, and it could be a motivator to see improvement and to ask, well, what is this person doing differently? So you could also do this blinded if you're concerned that people feel, and just say, hey, we have, this is what's happening right now. Let's see if we can minimize the variation. We could shorten the differences between providers and have it more consistent. So I see some more things in the chat. Variation in visit duration by visit type, number of tests and number of tests result delivered. Can someone share about how sharing by variation has helped them do QI?
Well, the variation in visit duration. You know, for example, in our clinic, we serve TB patient as well as the STD patients.
Mhm.
So naturally, the TB patients, if they are like not the follow-ups, I mean, it's 1.5 hours, at the top, but then usually 1 hour. But the STD patients' variation is much wider, and they usually don't cross 1 hour. So that's a kind of a benchmark variation.
Yeah.
So if STD patients, especially the express visit patients, if they are taking 1 hour, then we would flag those.
Okay, that's good. That's good. So I think the importance is that you're looking at how your whole system performs. If one area of your program is doing well and another part is not, is falling behind, the good question to ask from a systems approach is say, well, why? What are the different processes are being followed? And what are the different contexts that could be causing this situation? What is inherent to your system that is allowing things to be met or missed? And once you start asking those questions, it's not a blame game. It's just more like everyone is a part of the system, and you're looking at your data to find out where there's too much chaos, where there's too much unpredictability that's going on. And I want you to really see this as you can, when you map out what's happening on day to day, you could see that, this is my system. This is actually predictable. It's not as unpredictable as you see. You have an upper limit of where you perform. You have a lower limit. So your good days, it's a sum of your good days and the not so good days. And when you look at it as that way, you're having a system. You're just like, oh, we did great on Monday, yay! But oh, Tuesday wasn't so great. Oh, and then you just say, well, I hope the next day will be great as Monday was. Then that's not a system's view. System view is taking a step back and saying, well, why are we why is the divide, why is there such a great chasm between certain days or certain providers or certain clients or certain and then you look at your practices and your processes to distinguish what's going on, rather than just accepting we do great some days and some days something didn't happen, because you're really it's an average of all your days together, and looking at the data, you could step back and say, okay, we need to not look at it as it's random, and I hope everything works better tomorrow. We have to take back and look at your system and look at your data and say, this is my system, a sum of my great days and my not so great days. And you really make I think it really keeps us accountable when you approach the services you provide in that manner. So let's go back to a little quiz. Can you identify which of the following are special causes? So I have A, and you could just put in your chat or, the answer. So A, some doctors make decisions weekly while others do this daily. COVID-19 pandemic. B, COVID-19 pandemic in 2020. Is that a special cause? C, ordering different tests for the same clinical presentation. D, a hurricane. All right. Okay. Great. Great. Okay. All right, great. That's right. So B and D, those are special causes. That's unpredictable. You didn't know what's coming. Okay. Now you know it's coming, right? Now you know that what a pandemic is, because we've been in this for a while. But yes, B and D are, so in those cases, yeah, you could say, oh my gosh, this was a huge disruption to our services, and that's why our numbers are the way they are, because of these special circumstances. Those are the only times you have a bit of an excuse to say, we need to rethink and perform and work around. Sorry. But when you have when you think about common cause, like in A, it says some doctors make these decisions weekly while others do this daily. Well, why is that difference? That's a difference in process. And you're gonna have to decide, well, are we gonna get all the doctors on the same page and is doing it weekly better? Is it possible for everyone to do it weekly, or is it doing it daily the best? So you have to look at the variation between processes, and that's what your data should tell you. When you see the big division, the variation, you need to ask. It reveals your practices and your processes. Ordering different tests for the same clinical presentation. Okay, so you have to decide, why are we ordering different tests? Are we having different outcomes, less outcomes because we're not using the best test, right? So, your data really reveals, yes, thank you, Elaine. That's very real. Staff unusual turnover can cause variation. And that's a very important, I think that's something we need to talk about more, because I've seen really great high performing organizations, all of a sudden their numbers crater, and it's because they have key personnel exit their organization at the same time, and that's very hard to, and it happens sometimes. However, staff turnover, that is, and I'm glad that you mentioned unusual, because that's a key word. Because if a program has turnover and it's the norm that they don't retain their staff, then that is a common cause, believe it or not, because your system produces a high staff turnover. So you might need to do something regarding burnout, in staff, retaining staff, improving joy in your work, and different things like that. So an unusual turnover can cause variation, and that could be a special cause, but it also could be a common cause. And it's important to look at your data and really ask those hard, important questions. So not understanding variation, it's, if you don't get this aspect, you could fail to recognize predictable patterns. And that's very important to notice. I know a lot of times we think it's unpredictable. It's like, oh, I don't know, I hope I have a good day, I hope I have a bad day. But some of these are predictable. And if you look at your numbers over time, your best days and the average of your best days and your worst days is really, you could be able to predict what's happening. So you're not going to go above your upper limit or your lower limit. Another faux pas is treating a common cause as a special cause. And I think that's kind of like what I was describing, the idea like, oh, you can't count that you're lucky every day. You have to put in processes and practices that are going to minimize that variation, so you can have more predictable successes. Also, if you accept a special cause as a common cause, you might miss an opportunity to fix. And not taking appropriate actions for that process or system. So when you really look at your data and you really look at your variation, you can take the appropriate action to minimize the chaos and have greater success. So again, I want to reemphasize this quote, and I like to say this in almost every presentation I give, that every system is perfectly designed to deliver the result it produces. So if your system is producing high staff turnover, that's what your system is designed to do. And you have to look back, and you're going to have to improve the system in order to minimize those circumstances. Okay. So the next one looking at is a theory of knowledge. Now this, I believe this group is a lot more knowledgeable on, because we spent a lot of time talking about building your knowledge using the model for improvement. So in the context of improvement, a change is a prediction. If the change is made, an improvement will result, right? That's our hypothesis. So plan, do, study, act, the learning cycle. Gaps to predictions are studied and the theory is updated. Action is then taken on new learning. We are skillfully building knowledge by making changes and observing or measuring the results, and it's a foundation of improvement. So we all know how important building knowledge is. And when we do when we apply the model for improvement and we do our learning cycles of PDSAs, we're learning and we're building our knowledge. And, like we talked about hand washing earlier, that, you want to, how do you improve hand washing? Well, you might suggest, well, let's try a checklist, and maybe that would help, remind everyone to improve, to comply and to wash their hands. And you want to test that out. And if the checklist is, maybe the checklist wasn't accessible, maybe it wasn't, people weren't trained on it, and you just basically learn what the best way in order to make these improvements. So some faux right, of not applying the theory of knowledge, you can move towards implementing something without testing knowledge. And we all know how important it is to test something before you move to implementation. Another area that we could fall into is you could have confirmation biases. And lastly, you might not know if that implementation works in specific contexts. So, really testing out your knowledge is important, because it also allows, it also engages others in knowing that it works and to spread those good practices. Okay, psychology. So this is one of the, I think this is one of the most important areas when you talk about change. It's the theory of human behavior, the human side of change. So people's theories and their views affects their behaviors. And you have to understand there's differences in people, and we need to respect those differences, right? And so behavior is driven by motivation. You have intrinsic and you have extrinsic motivation. And, there's been a lot of conversations happening that intrinsic motivation is actually, more people are inspired when they're intrinsically motivated than extrinsic motivation, but they both work very well. So you want to attract people to change in more, and there's a lot of tools and way we do that. Some of it is engaging them, is how you introduce a project, you're testing out a small cycle, you're showing them the data, you're motivating them by bringing in client stories and keeping them accountable. And then another part of the human side of change is you have to understand the resistance to change. Resistance is a part of change. If you encounter it, you're doing something right. And that's it's important to look at, to accept that when you're introducing something new, that especially is super innovative, you're gonna have you're gonna have the early adopters and there's certain things, and we have to admit that there's certain things in life that you yourself are not going to step into until you see others step into it. And so just to respect that and understand that not everyone is going to have full buy-in right away, but there's going to be the other braver folks that want to try something new, and I'm thankful for them, right? Because that encourages me to also test it out and adopt. So just knowing that, that there is that resistance is a part of this, and that it will take a while to get everybody on board. So when you expect that, I think it really changes how you view change, especially when change is hard and people don't get it right away. You work with those that are champions who are very excited about it first, and you engage them, and then we work on spreading the good news when you have proven that it works, right? So so when you do not understand the human side of change, you will be discouraged by resistance, right? That will discourage you. You don't want to do it anymore. You give up, you stall your project because you couldn't convince this one provider or this one staff member to do it. You might say, oh, it's not going to work. But, but when you anticipate it, then it's different, So you might miss opportunities to provide intrinsic motivation, and you might miss opportunities to build ownership to change. So I think, this really helps us to, when we're doing our PDSAs, is to start small, right? And I really want to emphasize that I know a lot of times when we're excited about something, about doing something new, we want everyone to do it, everyone to drop it and do it this way right now. I think we forget, as much as we say it, we forget to start small. But I think it's very important to test things out on a small scale, 1 hour, right? One patient, one provider. When you jump the gun and you start really big, I see you, and you can encounter more resistance, or things can slow down. So I really encourage you to start small. Remember that. I think it's essential to making change in complex systems. So how to apply the knowledge of profound knowledge, apply the lens of profound knowledge. So here's an activity, and I'm going to show, so first step, I would say, so this is an exercise and this is a suggestion. Of course, you don't have to do it this way, but this is one way to kind of have your team kind of engage in thinking about when you want to make a change in a complex system. So you want to gather a small but diverse team, right? Have a facilitator and a team that's related to the process. And you want to use the profound knowledge worksheet. And I'm going to show it to you in a minute. It's really the 4 quadrants when you talk about appreciation of the system, understanding variation, the theory of knowledge, and the human side of change. So in this issue, example, I have increasing rectal gonorrhea tests among HIV positive adolescents. So okay, thank you, Shay. So who is involved? So you want to write who's involved when you want to increase this gonorrhea test. So I have adolescent clinic, the providers, the administrator, managed care plans, insurance, labs, clients, the client's guardian maybe, right? And then you want to know, what are the current processes? What are the standards of care when it comes to gonorrhea tests? What are the policies and procedures? What are the resources and equipment? So you want to exhaust the list of who's involved in the system. Now I'll show you the different questions to ask. So you gather together this huge team, this small but diverse team, and you want to ask in East Quadrant, who are the people in your system? What is the culture like? What are the structures? How do you organize things? What are the key processes in addressing this issue? So for instance, we talked about increasing rectal gonorrhea tests in a dollar sense. If in that discussion, someone talks about, well, adolescents, the clients are involved, but they are resistant to take the test because they have shame or they don't think they're at risk, then you'll move to the other quadrant and you'd add that aspect into human behavior. So you list the systems and you discuss and you ask these various questions. And if the conversation or discussion, they mention other aspects that fits in the different categories, you also list those in that category. And you do that until you complete these questions. So step 3, we want the facilitator supports the group to explore each of the lens area, either using natural discussion points to shift the focus or determining that an area is underexplored, so more time should be spent on it. So if you discussed, maybe there wasn't much discussion on insurance plans, the facilitator might want to go and talk about the role of insurance in improving rectal gonorrhea tests. And then lastly, you want to discuss prioritization. What area would make the most impact? What opportunity of change have you overlooked? What measures will you need to look at to examine variation? And I just want to mention and go back to this tool, because when you talk about everyone's who's involved in the system, you want to think, how are you measuring variation for everyone who's involved in that system? What is the knowledge base of everyone who's involved in that system? What's the human behavior of everyone's involved in the system? What's the behavior of the clients? What's the behavior of the staff that's providing the service? What kind of motivation do each person in the system needs? Okay, moving along. So here are some tools. So I just want to share the different tools that we use in quality improvement. They really can help us to help build this profound knowledge. You have the fishbone and the cause and effect diagram, right? That helps you to know who's involved in the system, and you could brainstorm the issues and the characteristics of the system. The flow chart, it shows you how the current system and subsystem work together, right? The driver diagram, it identifies gaps and opportunities. You have consumer feedback and surveys that helps to reveal blind spots. You have the 5 whys and force field analysis that helps identify bottlenecks, strengths and restraining forces. All these things give you information on your system. And you have your control chart and and when you drill down your data, that helps you to make system predictions and understand the common causes and special causes. And again, I listed fishbone and driver diagram and force field analysis they all help you to, I think this all helps you to move towards motivating people by identifying shared values, views, and know what drives others' behavior. I like force field analysis, like what are the driving forces and what are the restraining forces. And then lastly, the model for improvement, PDSAs, that helps you to focus on learning each cycle and building on prior knowledge. You want to think big, but start small, and to engage champions of change. And I really think that PDSA is designed to help engage human behavior. Any questions?
Could you elaborate on the force field analysis, please? Thank you.
Sure. So force field analysis is a simple tool, and it's designed, you'd write your issue up top, and you have on the left side, you would put the driving forces. What is driving you to make that change? And I like to use a force field analysis alongside talking about your system. So you'll have the different aspects of your system, and you'd say, well, what are the driving forces for your client to achieve this, right? What are the restraining forces for the client? What are the driving forces for your providers in achieving this aim? You know, what are the restraining forces? You know, is it time? Time could be a restraining sources. We all know your resources that you have at hand could be a restraining forces. For instance, I remember when, when we were having managed care plans, and they also wanted to improve viral suppression. And they also, I mean, if they're members of that managed care plans, if their members achieve viral suppression, then they actually save money, so so in that way, managed care plans driving forces is that, well, they save money. That's a driving force, right? So yeah, so force field analysis, you have the issue up top, and you have what are the restraining forces, and what are the driving forces, and what are the restraining forces on one side, and the restraining forces, and then you discuss what you can do to continue to strengthen your driving forces and to mitigate the restraining forces. Does anybody have example using a force field analysis? I said example, experience. All right, you're welcome.
I was actually going to ask not a follow-up question, but more of for my own personal, it's the end of the day, I can't talk anymore. How many people would be interested in doing a deeper dive for force field analysis by Nova West or another QI expert? Because we are always looking for new topics that you guys would be interested. Okay, I'm seeing, all right, so stay tuned for 2023 announcements. That might be another one we might bring Nova back for. Thank you all. And I did see in the chat there was somebody asking how quickly should they expect the slides and the recording. As quickly as we end this, I send it to Target. Not trying to rush anybody off, just saying I send it to Target, and Target HIV tends to take about up to a week at most to send it out. So look for it sometime, hopefully, fingers crossed, by next Wednesday. Hopefully people, not too many of our Target folks are taking vacation for the holidays, but 2 weeks at most to be safe. Any last words, Nova?
Oh, no, thank you. I was trying to say to everyone that I end up sending a direct message. You're welcome. Thank you, everybody, for your participation. You're a very lively group. I'm really glad that you engaged by talking back to me.
The chat is a good talk.
The chat is awesome. I love it.
Well, thank you everybody for joining us today. This concludes the end of our webinar for November. Stay tuned. For December, we are going to have our CQII Quality Award winners do a quick run through of the projects that awarded them the award this year. So look out for that announcement. And again, stay tuned for the 2023 calendar. You guys know how we send out monthly announcement when our next webinar is going to be. And if you're ever kind of trying to figure out what's next and want to kind of get a peek in, I might be able to tell you if you email me. So I'll put my email in the chat, or you can always email info@cqii.org. Yes, happy Thanksgiving to everybody.
Yeah, happy Thanksgiving.
Thank you all. Have a great
Thank
night.
you.
Bye.